Today's video is showing how to complete a head-to-toe assessment. Start with introduction and hygiene. Next, introduce yourself to your patient.
Hello, my name is Jennifer. I'm going to be your nurse today.
Identify the client.
Can you tell me your first and last name?
Next, explain the procedure, what you will be doing to the patient.
Today I'll be performing a head-to-toe assessment.
Start with general observations. Airway, breathing, and circulation. Assess vital signs and do a pain assessment.
Are you having any pain today?
Assess the level of consciousness and do a speech assessment if the patient is verbal. Do a safety assessment looking at the environment. Next, move on to the HEENT, starting at the head, the hair and scalp. Facial symmetry.
Can you smile for me and stick out your tongue?
Look at the patient's eyes and ears, nose, mouth, mucous membranes, and throat.
You stick out your tongue for me.
And the neck. Then move on to the chest and thorax, starting with the respiratory assessment.
I'm going to loosen your gown for a minute.
Inspect the shape and symmetry of the thorax. Observe chest expansion and accessory muscle use. Look at the skin color. Count the respiratory rate for 1 full minute. Describe the respirations. Palpate the chest wall, anterior and posterior. Compare.
Any tenderness?
Assess for chest expansion. Auscultate the lungs across and down the thorax with correct stethoscope placement over 6 anterior areas, 6 posterior areas, and 2 lateral areas.
Take a nice deep breath for me.
Compare lung sounds in all lobes.
Lung sounds are clear and equal.
Assess for coughing or respiratory symptoms.
Have you been coughing?
Next, move on to the cardiac system. Inspect the chest, locate the apex or point of maximum impulse. Auscultate heart sounds and count the heart rate for 1 full minute.
I'm going to listen to your heart rate for a minute.
Describe the regularity, quality of heart rate and rhythm, and identify S1 and S2.
S1, S2 present. Heart rate is regular.
Moving on to the abdomen, look at the gastrointestinal system.
Just going to close your gown up for you.
Inspect the abdomen for contour and distension, skin color, bruising, and scars. Auscultate the abdomen for bowel sounds in each of the 4 quadrants.
Bowel sounds active in all quadrants.
Lightly palpate the abdomen for tenderness or rigidity.
Do you have any tender areas?
If the patient complains of discomfort in an area, palpate that location last.
Abdomen is soft.
Identify when the patient last had a bowel movement.
When was your last bowel movement?
For the genitourinary system, inspect for bladder distension, palpate over the bladder, and identify voiding pattern.
When was the last time you urinated?
Next are upper and lower extremities. For the upper extremities, palpate the brachial, radial pulses, and describe the regularity, quality, and equality of pulses comparing side to side.
Pulses are strong and equal.
Assess the CSTMS. Describe the color, sensation, temperature, and motion, and cap refill of the upper extremities comparing side to side.
Color is pink and warm. Cap refill less than 3 seconds in all fingers.
Assess hand grip, describing the
Squeeze my
strength and
fingers.
equality of the hand strength.
Hand grips are equal and strong.
Next, move to the lower extremities. Palpate the dorsalis pedis and posterior tibial pulses. Describe the regularity, quality, and equality of pulses comparing side to side.
Pulses are strong and equal.
Assess CSTMS, describing the color, sensation, temperature, and motion, cap refill of the lower extremities, comparing side to side.
Color is pink and warm. Sensation, can you tell me where I'm touching you?
Assess the patient's foot press and pull, describing the strength and equality comparing one
Press
side to
down
the
on
other.
my hands and press up.
Do an overall skin assessment. Inspect the skin appearance, describing the color and skin integrity.
Skin is intact, pink and warm.
Identify the presence of any open areas or wounds.
Do you have any open areas on your skin?
Palpate the skin and describe the temperature and moisture.
Skin is dry and warm.
If the patient has an IV site, inspect that site for the appearance of the insertion site, any drainage.
IV site dressing is intact, no redness, drainage, no symptoms of infiltration or phlebitis.
At the completion of your assessment, again, begin with safety assessment. Ensure that the safety precautions are intact, the bed is in the lowest position, appropriate side rails are raised, the bed alarm is on if applicable, and the call bell is in reach. For hourly rounds, you would assess pain, positioning, potty, personal belongings, and peripheral IV, ending with, is there anything else I can do for you?
Is there anything else I can do for you?
Remove gloves and wash hands at the end.